Breast cancer in women aged 40 and younger is not very common. I did some checking and found in women aged 40 to 50, there is a 1 in 68 risk of developing breast cancer. Joining me via Zoom is radiation oncologist Dr. Scott Ackerman. Dr. Ackerman, it's important to point out we can only talk in generalities here because we don't know the specifics about Casey DeSantis' case. And the general consensus, according to researchers, is that breast cancer in younger women is likely to be more aggressive or metastatic in diagnosis. Why?
Well, we don't really know all the reasons why, but we do see that in women who are diagnosed at a younger age, that they tend to have a more aggressive cancer than women that are diagnosed at an older age. Part of the reason might have to do with hormones. And so in women who are diagnosed at an older age, tend to have tumors that are hormone receptor positive, which means they're sensitive to hormone treatment. They tend to have a slower growing cancer that's not as aggressive as younger women get.
And statistically, the survival rate among younger women is often not as encouraging as in older women.
In general, that's correct. But when you look at stage for stage, if a woman's diagnosed with early stage breast cancer, stage 1 breast cancer, regardless of her age, there's well over 90% survival rate, well over 90% cure rate. But women who are diagnosed at a younger stage, typically, or a younger age rather, are typically diagnosed in a more advanced stage than older women, and hence a lower survival rate.
Now, we talked about the fact that women who are in the 40 to 50 age bracket are, less likely to develop breast cancer than women in the 50 plus age bracket. But the numbers are increasing. You were telling me when we talked on the phone just before the news that the numbers are increasing and the risk is increasing. Why?
Well, there's lots of risk factors for breast cancer. One of the risk factors is having a strong family history of breast cancer. There's other risk factors such as smoking and alcohol use and those sort of things. But one risk factor we know a lot about is hormone stimulation or estrogen stimulation. And we know that if women get pregnant at a younger age, they have a lower risk of breast cancer than if they delay pregnancy. So what's happening in America is that women are going to college, they're pursuing careers, and they're doing all sorts of wonderful things. And in that, they're delaying childbirth. And the delayment of childbirth puts women today at an increased risk of breast cancer than they were 20 or 30 years ago when women didn't have those same opportunities.
Dr. Scott Ackerman, thank you very much.